So 4 signs of osteoarthritis are sclerosis. This patient has sclerosis. Another sign is cyst formation. And I'm not really seeing any great cysts on this one. Yep, there's a little cyst there. You can see these little black dots, those are cysts. So cyst formation. Joint space narrowing. This patient's got major joint space narrowing right here. Okay, where there should be space here. Now, of course, in that joint space is cartilage. So that's a sign that cartilage is worn away. And then the last thing is osteophyte formation. So this is an osteophyte here, beginning osteophyte here, a little osteophyte off the acetabulum. But we'll get more examples that are more obvious, but certainly this patient has all 4 signs of osteoarthritis on X-ray radiographic criteria for osteoarthritis. Here's another great example of hip osteoarthritis. Now this is nice because we have AP pelvis. We can look at the normal left side where you got some sclerosis of the acetabulum, but you've got preservation of your joint space. And if you look over here on the right side, again, that joint space is completely gone. You're rubbing superiorly, the joint space is gone, where the femoral head is rubbing the acetabulum. There's a complete loss of the cartilage there. Also on this, you're seeing nice osteophytes here off the femoral head, superiorly and inferiorly off the femoral head. We got osteophytes off the acetabulum. A great example of osteophytes and joint space narrowing, and the difference from the other side. Again, another view showing large osteophytes off the femoral head. Again, signs of osteoarthritis. This is an example of a knee with osteoarthritis. I would call this a varus knee. So this is medial, this is lateral. We know where lateral is because of the fibula, right? So the fibula is always lateral. So the medial compartment of this knee is narrowed. They call that bone on bone, where you're out of cartilage there. So you're seeing a large osteophyte off the medial femoral condyle and off the medial tibial plateau. You're seeing a lateral femoral condyle osteophyte. And again, a varus knee. So this knee is in varus, it's closed down medially. And the lateral view again shows osteophytes off the posterior femur, the anterior femur, cyst here, and osteophyte off the anterior tibia, osteophyte off the posterior tibia, superior and inferior patella osteophytes are here. So those are examples of osteoarthritis of the knee. Again, you have, here's another view where you have sclerosis, complete loss of joint space, osteophyte formation, pretty obvious. Typically, I'll do 4 views in my office. We'll get a PA flex knee view at 45 degrees. I get a merchant view. I put them on a special merchant board, and you're all welcome to spend some time with the radiology tech to see how they position people for x-rays. It's interesting how that works. You're all welcome to spend time with my x-ray tech. I do a lateral view, and I do just an AP standing view.